because the platform gives you the structure to do the things they want to do as an organization, because their focus is actually on building the best patient and provider platform in the market.
I'm Kristen Rubino with BrightSpring Health Services.
I'm Steve Hensel, Vice President Strategy with Landshore LLC. When Kristen and I were talking about the future of work, we were talking about the impact automation is going to have on that. But when I started looking at what is the future of work, to me it's really looking at what's the impact on your employees, as well as what is the impact on your customers, or in the case of BrightSpring Health, your patients. I then looked at BrightSpring Health and I said, this is a company that embraced the future of work before it even became a thing, because they've got process improvement built into their DNA. They in fact have a culture they call legacy, which begins with leadership and ends up with you take ownership, you learn more, you find better ways of doing things. When Landshore got engaged with BrightSpring, they had already started on automation, but they had hit a stopping point. They had a bit of disorder, and we brought some order to that disorder, and then we quickly helped them move from disorder to expansion to scale. And in 2022, we're actually looking at moving into hyper-automation and citizen development. So when Landshore got involved with BrightSpring, what did you think? What did you think of the automation program, and what did you want to change as you move forward?
I think what was amazing is how we did embrace it. We were automating and we were moving at full speed, but we ended up with automations that perhaps weren't complete, that were kind of spinning out of control. And so with the partnership from Landshore, we were able to spend more time on automation and less time on managing our automation, right? So they helped us. When he says disorder to order, that's really how I see it. And I think we talked about the number of automations that we moved from. I think we were at about 6 to well over 20 for the year. So it's been amazing.
So as you look at going from where you are today into the future, we've started talking about leveraging the UiPath platform a bit more, because it actually is what brought structure initially to help make it into an orderly environment. And now we're going to begin leveraging different components of that entire platform. So things like Automation Hub and the ability to do citizen development will allow them to scale. And again, the impact isn't so much just to the employee base, but it's the impact to BrightSpring's customers, because they've got 50,000 people and they touch millions of American lives across the healthcare spectrum every day. So when you think about automation and you think about it in terms of what your clients and the patients see, what do you see as the biggest impact and the best automations that you're looking at doing?
I mean, we've done a number of them, but I think the one that really allows more client-facing time is we have a fiduciary managed responsibility of client funds for a vulnerable population. And people coming in the morning, they would have to look at those funds, pull the bank statement, they would have to pull the balances and try to see if they could buy, Steve, a new pair of running shoes. Well, we automated, with your all's help, we automated that process. So now they come in and they know what that balance is. So it's not a compare this to this, it's Steve, he needs a new pair of shoes and we have X number of dollars to do it. They're done, they can help him get his shoes and spend more time with him, ultimately, is the benefit.
I agree, and I think it's been a good partnership, not just between Landshore and BrightSpring,
right,
but Landshore, BrightSpring, and UiPath, because the platform gives you the structure to do the things they want to do as an organization, because their focus is actually on building the best patient and provider platform in the market. So if Landshore, by helping them build a COE and helping them scale, can keep that off their back, they can focus on their core competencies, and hopefully we've been enabling you to do that.
Absolutely.
So what about UiPath Forward? Are you having fun?
Yes, this is fantastic. It's wonderful. I'm looking forward to going to some of the breakout sessions after this.
Kristen, it's been great talking to you. One of the things you told me a bit earlier was on the scale of some of the automations and the hours that you
Yeah.
were saving. Can you comment on that a bit?
I can comment on one automation that is it's 16,000 hours that
That's
people
huge.
can spend with clients.
That's amazing.